I mentioned that I had had my retirement party here at the Hartley Mansion in 2002, and it was a wonderful experience to have all the members of the surgical community show up and reminisce about the old days. They were certainly the good old days, and I have been very fortunate to practice anesthesia here in Everett for so many years and be a member of a very excellent anesthesia group which provided wonderful service for the community. We sometimes don't get recognized because we're sort of behind the scenes, and the patients don't really get to know us that well because all the time that they are in our care, they're usually asleep. We only have a short period of time before and after surgery to get to know them, but we still enjoy our patient contact and especially our contact with the surgeons. I have been somewhat remiss in waiting this long to mention the nursing staff at the hospitals. We work very closely with the nursing staff, and this again has been one of the great pleasures of our practices. Because we are able to interact with these people on a daily basis, it certainly has been an enrichment in my life, and I'm sure in all the other anesthesiologists that were in our group. We have seen many of them come and go. In fact, one of my partners, Dr. Donald Weiss, eventually married the surgery supervisor at Providence Hospital, and one of the other anesthesiologists in the community who had been in practice before we came married the supervisor at General Hospital. So things like that do happen. I want to go back a little bit. I forgot to mention that the history of anesthesia in Everett prior to Dr. Mason and Weiss coming here was somewhat checkered. There had been a, quote, anesthesiologist, unquote, practicing here who was found out to be a Navy corpsman and not actually a doctor. So he had to leave. Another anesthesiologist came to practice here, but he found it necessary to share the drugs with the patients, and he had to leave. The third anesthesiologist eventually was committed to Northern State Hospital, and then following his discharge committed suicide. Needless to say, this put some pressure on the new anesthesiologists in town to be a little bit better than the previous anesthesiologists. And that was the case. The anesthesia got rid of its bad name in this town as far as anesthesiologists were concerned, and we hope that the medical anesthesia group had certainly had some effect on that. We continued to employ nurse anesthetists for a number of years, although just one or two, and for a very short period of time we had 3 nurse anesthetists here. It was felt by the members of the group that we would rather give the anesthesia ourselves than try to supervise numerous other people, and our nurse anesthetists were given more of the minor cases, and also were given supervision by members of our group. We did not feel it was in our best interest and in the patient's best interest to have a large number of nurse anesthetists supervised by a rather small number of anesthesiologists. My wife and I have enjoyed our 40-some years in this community, and I reminisce a little bit about the old days and how different it was. I was able to actually coach Little League teams in my early years of my practice. It required a lot of trade-offs in my call schedule so that I could be present for the games, but I coached Little League teams for years and years, and then ultimately when my youngest son grew out of Little League into Pony League, I coached his team until he was 14 years old. At that time, our call schedule was a little bit lighter, and we were able to do things like this. I had 4 boys, all played baseball, and at one time they were all playing on 4 different teams. This was quite a logistic problem for our family, as my wife had to drive them to all these different ball fields, and I would coach one team. And we ate a lot of hot dogs, and my wife swore that she would never ever eat another hot dog. But we are baseball fanatics, and we go to the Mariner games and we eat hot dogs. At one time when my youngest son was playing Legion ball, we went to he played a doubleheader in Kent in the afternoon, and then at night we went to a Mariner game. So that day we saw 23 innings of baseball and loved it, even though the Mariners weren't too good in those days. We lived on Taylor Drive and still live there. We moved into that house in 1964, and so we have been there for 45 years, which I guess is pretty long for most people to live in one house. And I'm hoping to stay there until they carry me out. We were very active in skiing in the community. We joined the Everett Ski Lodge and spent many of Friday, Saturday, and Sunday at the lakes or at the Stevens Pass ski area. That was a way to spend the dreary days in the winter, and as my wife said, if it weren't for skiing, she wouldn't have lived here. In the summertime, we enjoyed golfing, and we have an RV, and we enjoyed going to the ocean and traveling around the Northwest and all of the West Coast.